Imagine waking up with fresh breath and no sensitivity throughout your day. Picture going to sleep, knowing plaque didn't get a free ride overnight. That's the power of a smart 24-hour oral care plan. Today, we'll follow a simple timeline: morning, meals, commute, and bedtime. This plan protects your teeth, gums, and breath with just a few minutes at a time. Stick to it for 7 days and truly feel the difference. Welcome back to the channel. This is a down-to-earth guide anyone can follow, even on a busy schedule. We're focusing on the right steps in the right order, not complicated routines. At the end, you'll find a one-page checklist and a 7-day challenge. Let's start by optimizing your mornings for better oral health. Why brush before breakfast? Overnight, bacteria build up and produce acids in your mouth. Brushing first removes this film and adds fluoride protection for your first meal. Begin by rinsing with plain water to loosen any overnight buildup. Then, brush for 2 minutes with a soft brush and fluoride toothpaste. Angle your brush 45 degrees to the gum line, using small circles to cover all surfaces. Gently clean your tongue with a scraper or the back of your brush. This simple step significantly helps with morning breath. If your mouth feels dry, sip water, avoiding sugary drinks. If you prefer brushing after breakfast, wait 20 to 30 minutes after acidic foods like fruit, juice, or coffee. This prevents brushing softened enamel. In that waiting window, a quick water rinse is beneficial. If you've already brushed before breakfast, there's no need to brush again immediately. Instead, focus on these simple steps. Rinse your mouth thoroughly with water. Then, chew sugar-free gum for about 10 minutes to stimulate saliva production. Saliva is your body's natural enamel bodyguard. If food frequently gets stuck between your teeth, use a quick interdental pick. This helps dislodge particles and keeps your mouth feeling fresh. Many of us sip coffee or tea during our commute. That's perfectly fine, but add a layer of protection. Pair every coffee or tea with a few sips of water. This helps reduce staining and prevents dry mouth. If your breath starts to feel stale, reach for a sugar-free mint or gum, not sugary options. If your job involves a lot of talking, keep a small water bottle nearby. Consistent hydration prevents dry mouth, which can contribute to bad breath and other issues. After lunch, follow these practical steps. Start by rinsing your mouth with water. If possible, floss 1 or 2 problem spots where food always seems to get trapped. If brushing is an option, wait 20 minutes after acidic foods, then do a quick 2-minute brush without over-scrubbing. If brushing isn't practical, simply swish water for 30 seconds and chew sugar-free gum. These small actions make a big difference. When it comes to snacking, frequency matters more than the total sugar consumed. If you snack, try to group your snacks together instead of grazing all afternoon. Choose tooth-friendly options like nuts, cheese, yogurt, or crunchy veggies, and always remember to drink plenty of water. If you drink sodas or energy drinks, use a straw and rinse with water afterward to minimize contact with your teeth. As your day winds down, consider a few extra steps. If you work out or take medications that cause dry mouth, plan for extra hydration. If you tend to clench or grind your teeth, make a mental note for your bedtime routine. Mouth guards are crucial for protecting your enamel from damage. This is arguably your most important oral care session of the day. Think of it as a deep clean before sleep, because saliva flow significantly drops overnight. First, floss thoroughly for 2 to 4 minutes. Glide the floss along the side of each tooth in a C shape, gently sliding it under the gum edge, then move to the next contact. If you have spaces, bridges, or braces, interdental brushes might be more effective. Next, brush for 2 minutes using a soft brush and fluoride toothpaste. Use gentle circles, spending roughly 30 seconds per quadrant of your mouth. After brushing, spit out the foam, but don't rinse hard with water. This allows the fluoride to stay on your teeth a bit longer. Then gently clean your tongue for 10 to 20 seconds using strokes from back to front. Avoid over-scraping. Mouth rinse is optional and targeted. If using a fluoride rinse, use it after brushing and do not rinse with water afterward. For other rinses, follow the label directions and again, avoid rinsing with water immediately after. Finally, do a dry mouth check. Keep water at your bedside. If you mouth breathe or snore, discuss this with your dentist or physician. Humidifiers or medical support can often help. For those wearing orthodontic appliances or night guards, clean them daily with a non-abrasive cleaner. Never store them wet and dirty. If you wear dentures or partials, clean them thoroughly and soak as directed. It's crucial never to sleep with dirty appliances. If you have sensitive teeth, consider using a desensitizing toothpaste at night. Dab a pea-sized amount on sensitive spots and do not rinse it off. Once a week, check your toothbrush bristles. If they are splayed, it's time for a replacement. Consider using a plaque disclosure tablet on weekends. This helps you spot areas you might be consistently missing during your daily brushing. Track any bleeding points during flossing. If bleeding persists beyond 1 to 2 weeks of consistent care, schedule a dental checkup. Drink water consistently throughout the day to maintain a healthy saliva flow. Balance your intake of coffee, tea, and alcohol with water to reduce dryness. After strong-flavored meals, a water rinse, sugar-free gum, and a thorough tongue clean at night can help keep your breath fresh. Prepare a small kit for travel or busy days. Include a foldable soft toothbrush and travel-size fluoride toothpaste. Don't forget interdental picks or flosses, sugar-free gum, and a small water bottle. When time is tight, follow a 2-minute plan. Water rinse, floss, problem spots, quick brush, then gum. For the next 7 days, commit to these habits. Floss every night without fail. Brush for 2 minutes, twice daily, and clean your tongue every day. Rinse with water after consuming coffee, tea, or snacks. Chew sugar-free gum after meals when brushing isn't possible. Rate your morning breath and gum bleeding on day 1 and day 7. You will undoubtedly notice a significant difference. If this timeline helped you, please save this video and share it with a friend who might feel too busy for oral care. For those interested in oral microbiome support, check the description for additional resources. Always remember, no product can replace consistent brushing, flossing, and regular dental checkups.